Hello and welcome. I'm Ramesh Ramachandran and you're watching a special broadcast here on DD India. And I have with me a very special guest, Dr. Henk Bekedam, the World Health Organization's representative to India, to talk about the COVID-19 pandemic and the WHO's role in breaking the chain and combating the virus. Dr. Bekedam, thank you for making time to be on DD India. Appreciate it.
Thank you.
Now, Dr. Bekedam, you've had a rather illustrious career in WHO. You spent 24 years in the organization. You've served in Cambodia, in China, in Egypt, in Manila, and now you are heading the, one of the largest countries in South Asia and around the world. 1.3 billion people living in India under lockdown to break the chain, so to speak. Now, reflecting on your career and bringing you back to the contemporary times, you've seen the SARS outbreak in China in 2002, 2003. What's your assessment of the Indian government's response to the coronavirus pandemic in terms of enforcing a countrywide lockdown, enforcing a flight ban early on, and the measures taken in the interim to combat the spread of the disease?
Thank you very much, Ramesh, for having me. I think a few things which I would like to start with. And I'm reflecting also a little bit from about the SARS was in 2002 and 2003. One thing is very important, also for COVID-19. We're already for 4 months in it, but at the end of the day, it's a new disease. Right. And just what we did at that time also with SARS, what we said, we are sailing while building the ship. So there's a lot of learning going on. Even now, 4 months in it, and we're still learning about the clinical symptoms. We've learned now recently that blood clots, for instance, for patients who are dying, that's a very important observation that we have seen. And that means that sometimes the symptoms can be very different than only the cough and the fever. So these are some of the things that we continuously are learning. Now, if you go back, what is very important with any infectious disease, any new disease, the earlier you start the fight, the better the outcome will be.
Absolutely.
And here I have to give a lot of credit to India. India, when they were hearing about this, early January, they were on it. When I came back from my leave, and I think I came back on the 13th of January, on the 14th of January, the ministry had already met. And of course, I met them on the 14th of January. And within days, the secretary made sure that she started talking to all the states and said, look here, there's a disease, we don't know yet much yet, but please be on the alert. In that same week, at the end of that week, I think the Prime Minister's office was already involved. And from the onset also, the Modi government made sure that it was not only a response by the Ministry of Health, but it was an all-government approach. And all these things are very important. And again, go back again from, if you start early fighting it, then you have a good chance to keep what we call now the curve flat. That is not the same that it will be a guarantee for the future, but it's definitely, that's the part where I really think that India had a very good start. And I can recall that even when the numbers were very low, that we're already involved, and as WHO, we're very proud of part of it, we started training all the districts. And we have more than 700, as you know, in India. All the districts got basic understanding about disease, basic understanding how we could prevent it, etc. And that was extremely important. And India didn't wait. India acted. And we were very proud to be a partner of that.
Dr. Bekedam, we've seen India take a number of measures, as I mentioned before, a countrywide lockdown. The size and scale of India, a country of 1.3 billion people, Dr. Bekedam, in lockdown for weeks on end. Now, many people call it a startling phenomenon. Now, we had Wuhan, a city in China, in lockdown, but here's a country of 1 billion plus people and counting in lockdown. And many people say that was one of the reasons why the numbers are relatively low as compared to other countries. So on balance, with the benefit of hindsight of the last few weeks, how would you describe Prime Minister Modi's decision to, as I mentioned, enforce a lockdown, take an early flight ban and other measures to sort of keep the numbers under check and the death toll as well relatively low?
Extremely important, but I would like even to add on this one. In addition to the lockdown, I think what India also did is started in the meantime strengthening their surveillance system. And the surveillance system is very important. Whatever you do with a lockdown, that is very good. But India combined it also with strengthening the surveying, doing the testing, doing the contact tracing, isolate the patients, and also putting those contacts in quarantine. And I think that's extremely important. What we now already know from this virus, and if I then would reflect on the SARS, SARS, this disease was only spreading when you had a fever. And therefore it was easy to tackle. What we know now, we have actually many people who have either what we call pre-symptomatic, that they don't have yet any symptoms, they might, but also many of them who have very mild symptoms. Now, if you're ill, you're not moving. When you're not ill, you're moving. And I think that's the part that makes it so much more a challenge to control the disease. And look at the numbers. SARS, at the end, we had 8,000 cases globally in a month of about 6-7 months. Now we are in the millions. So that's also one of the big challenges. So the lockdown combined with the other parts, with the surveillance system in place, but also getting the hospitals ready. Because it is also true, a small portions of the people who are getting this disease, they need the hospital treatment.
Dr. Bekedam, the first case of COVID-19 in India was reported, I think, in the end of January, if I'm not mistaken. But the question is, has India peaked yet?
I think the peak is something very difficult to predict, and I think many people have tried, and I would have perhaps a little bit different version on this. This virus has been able to reach every corner of the world. All countries are affected. This virus has the potential to reach every corner of the country. And therefore I think it is very difficult to talk about when the peak will be. We are still learning. We still don't know if the season will have a major influence. We hope it will. Coronavirus generally do not like the hot weather. But talking about the hot...
So temperature has an effect on the spread of the virus?
No, it could be. But there are two things about it. It does not make a difference if you have a direct contact, meaning direct transmission from one person to the other, directly in the air and not going to a surface. It doesn't matter if it's freezing or it's 50 degrees. But it could have to the surfaces, potentially, the virus doesn't like the heat, potentially that the virus will be less viable when it's on the surface. So it could be. But again, we are learning. What we also know from the MERS virus, which is also a coronavirus, that one actually has never seen the seasonality part so clearly. So this is one of those things that we need to start really closely monitoring. And go back to your peak, what the most important part is, peak or no peak. And I think then I would like even to refer what India is doing now with the containment zone and the 3 colored districts. Containment is the most important part. Whichever you are, even when you have one case, try to contain, because what we do know, that one case can become a cluster. And that's also the part that I appreciate from the strategy what is now in front of us, that the country is focusing on containment itself. And even a few cases, we need to be on top of this.
Indeed. And Dr. Bekedam, talking about the cure for COVID-19, now many countries around the world are experimenting with various drugs and methods. India, for instance, shared pharmaceutical supplies with many countries around the world. They supplied hydroxychloroquine, paracetamol. I'm told HCQ with azithromycin could do wonders. We've heard about stem cell therapy, plasma therapy, and now we're told about remdesivir. The Japanese government has authorized the use of remdesivir as a potential cure for COVID-19. Help our viewers understand, is there a cure for COVID-19 today as we speak, and do any of them qualify as a drug or a potential drug for COVID-19?
Not yet. Not yet.
So none of these are a potential cure?
No, but again, at the same time, quite of them are very promising. What you do with science, you need to have enough information before you declare something. What we have seen with remdesivir, that at least it's able to influence the period of cure, of getting better. I think there was evidence that if you take the medicine, that on the average patients were curing in 15 days, and when you took the medicine, remdesivir, it was 11 days. Now, these are conceptually very important. It looks like that there is a medicine that can influence somehow the reproduction of the virus, or even attack the virus. So, but it's not yet sufficient to say from that it can cure. But here's also very important, and the WHO is very much involved in this one, and we're very glad that India has also joined. It's important to get the evidence. And how do you get strong evidence? When you have sufficient numbers. When you test 10 people and it worked with 2, it might be coincidental. But when you have a large trials and you have large numbers, then you can assert we have the evidence. And that's also what WHO is doing, and India has joined, is that what we have the solidarity trial, and that's making sure that we do the trials in countries. and they have the similar protocols, and then we start comparing the data. So then we have quicker building up the evidence, and that's very important. But may I also just reflect, when you have a new disease, there are three tools that you try to develop. One is diagnostics. Diagnostic, we're still also learning. As you know, with antibody testing, there's been a bit of a discussion. We still think we're still looking for even better diagnostics. Some of them are good, some of them are not so good. And whatever you do with these kind of things, you need to validate them. And the second tool is indeed the medicines. And some of medicines are very promising, and we're very happy that India is part of it. And the third one is vaccines. And the vaccines one, there's about 89 at this very moment that they are being developed, of those 89 even plus, and 7 to 8 are very close to clinical trials. And this again, when you do it jointly and you pull all the data together, then earlier you will be able to see what's happening. Now, India will have a very special role. You were already alluding to it. India is the pharmacy of the world. And it is a pharmacy of the world because it is exporting a lot of generic medicines and vaccines. Right. Look at the vaccines. 60% of all the vaccines are coming from India. WHO is very proud to be part of it because we are together. We are supporting India to make sure that they're quality vaccines. And they're very popular and they're very good. Now, in the vaccines part, there are 3 stages. One is finding an effective vaccine, and then the second one is trials. Right. And the third one is, if you would have an effective one, which is then through the trials also safe and still effective, then you need to make sure that you do the scale up, because everybody is susceptible and the whole world needs that vaccine. Mm-hmm. And India will have, in all these 3 stages, will have a major role to play. Either way, India will be part of discovering it. Right. And in that sense, I think we should also recognize that the research capacity in this country is very good. Or if it's from elsewhere that is a very effective vaccine coming up, they will be able to help to scale it up, because India has the capacity to start developing vaccines.
So is WHO collaborating with Indian government or Indian agencies on vaccine trials, for instance, in India?
Yes, they do. And I think the ICMR has signed also this contract, and we're very proud of that. We also know that the Serum Institute in Pune is a very important institute, because they are one of the engine for the vaccine development, etc. And that's very important. That's also what we know. With a new disease, and as big as a challenge that we have now, we need countries to work together. We need to do things together, because this is a pandemic. This is everywhere. And it needs also all countries and all science and all research to come together.
Absolutely. And when we talk about the COVID-19's origin and spread to all corners of the world, Dr. Bekedam, various models are being spoken about. There's a South Korean model, a Swedish model. Some say an Indian model could also be a viable alternative in terms of enforcing a lockdown, flight bans, and in particular, Prime Minister Modi's decision to have a people's-led lockdown, a countrywide campaign, so to speak, of putting 1.3 billion people in lockdown to tell them to stay at home voluntarily. So is there, in your estimation, an India model at play here? And if so, is that a viable alternative for some other regions or countries to emulate as well?
Let me just reflect on a few things. One thing we know for sure, one thing we know now is that different than with the SARS is not a threat anymore, because that virus we were able to put back in that bottle, the genie back in that bottle. It's not a threat anymore. That is not the case with this one. COVID-19 will be with us. And I think will be with us for the years to come.
So we have to learn to live with it?
You have to learn to live with it.
For the foreseeable future?
Now, but what we're of course hoping for, that there will be an effective vaccine. Then at a certain moment we can look again and start changing the whole course of it. So, but at least for the next 1 or 2 years, it will be with us. And therefore, I think we need to start...
Sorry, next 1 to 3 years?
I said 1 to 2 years.
Is this a new normal we're talking about? Social distancing, people working from home, no handshakes, only namaste. Is that the shape of things to come?
Yes, and India is well prepared. The namaste is already there. And that is indeed, I think that is indeed true. We do not yet have the tools to really start getting rid of this virus. And I think in that sense also, but that's again, I go back again, how important it is that all the scientists are working on medicines, that they're working on vaccines, and that we all do it together.
And Dr. Bekedam, if I would to ask you to take a step back and reflect on the months that have lapsed, starting with end of December, when the first case was reported in Wuhan, China, and till now. Does the WHO have a concrete idea of a timeline, and especially in relation to India, from the start of the outbreak in India and till now? So is there an understanding or consensus on the timeline so far as India or South Asia is concerned?
Yes, and I think I'll go back for what I was just mentioning. From when India heard it, I think on the 7th of, there were a few announcements. It was announced on the 31st of December. There was announced on the 7th of January. I think that India met already on the 8th of January.
Because the controversy surrounds the decision to delay the declaration of a pandemic by the WHO. And that came about only in the 3rd week of January. So did that, add to the delay on the part of responses by other countries, including India, for instance?
Not really. And by the way, the pandemic was declared a little bit later. It was first a public health event of international concern. It was by the end of January. But India acted from the onset. I feel very proud that India had already met on the 8th of January. And like I told you, I came back on the 13th of January and we had meetings. India did not wait for any announcement. Many countries didn't wait because also information was shared already also by WHO from, look, there is something going on and that could be a very serious threat. And for me, it was a déjà vu. It was a coronavirus again. And I wish it would have been the same coronavirus than one before, because that one we were able to put back in the bottle. The genie we were able to put back in the bottle. This one is more serious. This one is a bigger challenge because people are also spreading when they're actually not that ill. And I think that, or even not having very mild symptoms. So for the action in India, these things were not important. India was acting already far much earlier, and we as WHO, we were also very happy to see this, and we were encouraging. And my discussion with the secretary, my discussion also with the minister on this one was also from this is and get ready. But I didn't need to say it. It was India's decision. The secretary didn't wait for one moment to start making sure that all the states were prepared. The India government didn't wait for one moment to make sure that it was an all-government approach. And that was already happening mid-January onwards.
All right, time for a very short break here on this special broadcast. When we come back, we'll discuss about the lessons learned from the COVID-19 pandemic. Don't go anywhere. Welcome back. You're watching a special broadcast here on DD India, and I still have with me a very special guest, Dr. Henk Bekedam, to talk to us about WHO's action plan going forward in relation to India. Dr. Bekedam, your thoughts on what WHO might be planning to do in collaboration with the Indian government in the next few weeks or months?
Actually, I think we're working indeed with member states, and India, I think, has already quite a few plans, and we're providing advice in the whole process. I think, as you know, we're now in a phase where we have to move from a lockdown to the opening up.
Right.
And if you see from the lockdown number 3, some people are even mentioning it's a little bit of opening number 1. And I think that's important. I live here in Delhi. I'm very happy that my shop in the A block market is open, because I think people we need to get back to business. But it is true, we need to make sure that a few things are in place. Surveillance system will be extremely important.
So surveillance is important.
Is absolutely important.
Okay.
And surveillance system that includes also the testing and making also sure that you thereafter you follow up with contact tracing, that you isolate the patients and that you quarantine the contacts.
So surveillance, contact tracing and testing
is extremely important. And for that one, I think we're still learning, because we most likely, the more proactive we are in the testing, the more you understand what is going on. Now look at the testing in India. It has been a topic, but I'm very proud that at this very moment, on a daily basis, at least India can already test 75,000 on a daily basis. Now, and what the good thing is that I've also spoken with the chair of the Empowered Group, who is responsible for this. India does not want to stop over there, and that's very important, because whatever you have, if you have even low numbers, it doesn't mean that you shouldn't be looking for it, because this virus, as we know, it might appear very suddenly, because people might have been spreading it who were having no symptoms or very little symptoms.
So there could be a second wave in some of the green zones potentially?
Absolutely, that is possible. We do not know, but so therefore you need to have certain things in place that you on a regular basis, that you do test, and especially what is important is, for instance, the people with symptoms, because that's, of course, if you start doing random testing, it might be turning out very negative, very large numbers negative, and you might even have not a lot of action on it. But what we do know, if you have, for instance, people, what we call severe acute respiratory illnesses, if you have people what we call influenza-like illnesses, ILI, those ones, test them, find out, they could be COVID. And that part needs to be in place, and I think that one is being strengthened throughout. That's also one of the reasons I think you see some of the numbers going up. There's a lot more testing going on, and that is very important. But also the follow-up is crucial. And that's also the force that we're looking forward to in India. And where WHO, with our team who were helping and supporting India to eliminate polio, we have a field, our field staff are there. They're there to support. Actually, every single hospital should be aware, even when you called your so-called a non-COVID hospital, that the person who enters your premises could be. So we need to make sure that everybody is aware. That
everybody is a suspect in the terms of the medical fraternity today, right?
I do think we need to...
Asymptomatic or symptomatic?
Yes, and I think that's what we're learning. We need to be far much more ready for this. That's a bit uncomfortable, because you rather deal with those people who are clearly ill, but we need also to make sure that people who have not been so ill, etc. But then I go back again, that's the reason why the surveillance system is so important.
Right. Just a quick follow-up question on the lockdown, Dr. Bekedam. Now, it's generally said that democracies find it difficult to enforce a lockdown because they are open, transparent governments. There's a free press, so unlike authoritarian governments or countries, like for instance in the US, we've seen President Trump speak about reopening the economy, but he's left it to the states concerned to deal with the situation. On the other hand, in Brazil, we've seen the president talk about reopening the economy in one fell swoop. Italy is also partially reopening the economy. But in India, we are still in the phase 3 of the lockdown. In WHO's assessment, is there a reasonable timeline or a method to determine when to partially begin easing the lockdown?
I think it's very difficult to say. The only thing what we do know that the lockdown is not a long-term solution. That is not possible. Like you and I already agreed upon, from the next 1 or 2 years, we need to learn to live with it. But we need to do it in a very responsible way. And like I mentioned before, if I look at the lockdown 3.0, it looks actually also like an opening 1.0, because my shop around the corner is open. When I now travel in Delhi between 7 a.m. and 7 p.m., there are a lot more activities going on. And we need to do this. But social distancing, a surveillance system over there, awareness, and keeping each other involved is very important. I liked also one thing what you just were mentioning, involvement of the community. There is no disease that you can fight without the community involvement. At this very moment we have some special challenges also in what we see in the urban areas. If we look at this very moment at this disease, it is actually more a challenge in urban areas. and even more in urban, densely populated areas. What is important, and that we learned also from the Ebola. In the Ebola, we didn't listen enough to the people. Here we need, from the onset, we need to listen and we need to engage. And if there's clear there's not enough understanding, we need to engage more. We need then to make sure that we get the community on our side to fight the disease. You cannot win any disease with a fight if the community is not with you.
Absolutely. And talking about WHO, Dr. Bekedam, there's a lot of talk about the funding or the methods of funding the WHO's activities in India and around the world. The US has withdrawn funding to the WHO. Talking about South Asia in general and India in particular, are there any talks between the WHO and the Indian government on increasing the funds for the WHO's activities in the region?
Now, India has been a great supporter for our programs and one of our major donors of the current program. And the people that I was just talking about in the field, most of them are actually funded also by the India government.
Right.
So in that sense, I think at this very moment, we are just focusing on the work what needs to be done. And that is very important because there's a lot of work to be done.
Absolutely.
And I think we cannot have any complacency at any time because we do not know how this virus works. That's also something very interesting in India. This is the first country where I'm aware that you have actually 2 flu seasons. You have a flu season, the usual, in the colder period, but you also have a flu seasons around the rainy season.
Right.
Now, we do not know how this virus will respond. I understand that virus doesn't like humidity, so I hope it will actually, the humidity will even help. But these are all the things that we need to closely monitor. And then I'll go back again, that's the reason why it's so important to have a surveillance system in place and also the community. The community should become part of your eyes and ears. They should at a certain moment start saying you have a bit of a fever, why don't you go over there? Or let's at least do a bit of social distancing, etc. So these things will be all very important.
And finally, Dr. Bekedam, if I were to ask you to reflect on the pandemics, the current pandemic and similar pandemics in the past, with the benefit of hindsight from this episode, would the WHO respond differently if this were to repeat itself sometime going forward?
I think that
in other words, what's the lessons learned from this episode, ongoing episode?
This episode is also confirming some of the things that we always have been talking about. People need to invest in health.
So health security is front and center of the global narrative
Absolutely. Today. We need to start strengthening system. What can prevent, what can early detect, and can respond well to a threat like this. And in that sense, I think all governments need to start looking again, was our system strong enough? Shouldn't we strengthen certain parts of the system? And we know we have been working in this era, and many countries in Asia, they have a strong belief in the private sector and the market. I am believing that too. But in the health sector, certain things the government needs to be doing because the market doesn't work well. So the investment and the funding by the government itself in the health sector is absolutely crucial. And that is one of the things that we, I think, have been learning again during this current outbreak.
Indeed. And finally, Dr. Bekedam, I'm told you're going to hang up your boots in the next few weeks and you'll bring your career in the WHO to a close. What are your plans for your second innings, so to speak?
Now, my heart is in public health, and therefore my heart is with WHO. I might take a rest, but I will be there.
All right, Dr. Bekedam, I wish you all the very best in your future endeavors, and thank you for making time to be on DD India. Appreciate it.
Thank you very much, Raj.
And that's a wrap on this special broadcast. But news continues here on DD India. You can catch all the latest updates on our social media, mobile and digital platforms. Thanks for watching. Bye-bye.